I'm Laura Weidt. Good to see you guys again, and welcome to our newborn series that we're doing. I'm going to talk about what happens in the newborn nursery after your baby's born. First thing I like to talk about is the minute your baby's born, we really recommend that you have as much contact with that baby as you can. Having skin-to-skin contact right after birth is really important. It really sets up that bond that you're going to have with your baby. Also, having a feeding in the very beginning of that first hour is really, really important if you can. Whether you're nursing or whether you're bottle feeding, but especially if you're nursing, to have a skin-to-skin contact and have a really good feeding with that baby in that first hour. We will recommend that a lot. Baby's gonna stay with you as much as possible in your room. We recommend that. We encourage that for you to keep your baby in there and help with all the little things that you have to do with him or her. Changing baby, dad can help, all that kind of stuff. Probably once in a while you may be very, very tired, or if you're having some complications after the delivery, it's absolutely fine for you to let us know, and we are happy to take the baby into the nursery for a little while you rest. A lot of times other places don't really recommend that or encourage that, but we definitely want you to, especially if you're having some problems. The next thing I'm going to talk about is a couple of shots that your baby has to get when they're in the hospital the first time. The first shot is very, very important. It's the vitamin K shot. Vitamin K is a special vitamin that is a cofactor in clotting, and it helps prevent something called hemorrhagic disease of the newborn. When babies are born, they don't have enough gut bacteria in them to help have their body make vitamin K to use as a cofactor, and therefore we have to give them a little extra. Even if mom takes vitamins that have extra vitamin K when she's pregnant, the placental transfer of vitamin K is not very good. Second, even if mom takes it while breastfeeding and things like that, it still does not transfer into baby very well. And so it's extremely important to do vitamin K to prevent that hemorrhagic disease of the newborn. If we're going to perform a circumcision on a boy, we really don't recommend it unless they've had a vitamin K shot. The next vaccine I'm going to talk about is hepatitis B vaccine. It is the first vaccine that your child will receive, and it is extremely important. We've been giving it since 1991, not an extremely long time, but we've recommended it in the newborn phase since then. Prior to that, under the age of 10, we had about 16,000 cases of hepatitis B nationally every year, and that's a lot. Even though it's not a huge number, it's a lot because hepatitis B is very devastating. There are about 1 million carriers of chronic hepatitis B in our country. And it's very difficult to know if and when your child will ever be exposed to that. Sometimes we see that it can be found in like toothbrushes for up to a week at a time. It's in blood product, and it can be in bodily fluids as well. So you can get it on toilet seats and things like that, and it's just very important. We recommend that one prior to going home. After one vaccine, there's greater than 50% immunity to it. After the third vaccine in a series of 3, they are 98% immunized from the hepatitis B. The next thing I need to talk about is iloticin, which is erythromycin eye ointment. And every baby gets eye ointment right after birth within that first hour or two. We recommend it. It's in prevention of gonorrhea in the eye, which is called ophthalmia neonatorum, and it helps prevent that. Even if you don't have a history of chlamydia or gonorrhea or any other sexually transmitted disease, it's really important to do this. The effects of gonorrhea on the eye are much worse than the risk of the iloticin in the eye. If the child does get gonorrhea in the eye, it can ulcerate the eye, ulcerate the cornea, and cause lifelong issues with vision. So I've said a lot about the first part of your newborn phase after you have your baby. I've talked a lot about things that go into your baby. I think it's really important that you guys become comfortable with us and ask us questions when you have them. The nurses know some things, but the doctors can really answer questions. It's a lot to take in that first day or so of after your baby's born. The next part of our series is going to be by Dr. Beckett. He's going to do the second part of our newborn nursery part, and he'll be here soon. Thanks.